Yeah, I don't know what happened, but I'm about to finish anyway. I am about to finish. Anybody there? Anybody there? I don't know what happened. I don't know. Claire, welcome back. I don't know what happened. So, one of the biggest things that, let me see. One of the biggest things that I always tell people is that support is very important. I was talking about alcoholism and all types of. If you want to be with me, that is fine. I will allow you to come with me. As I said, that once you admit, one very important lesson about addiction is to have support from the family. So I've seen families that have actually, families that have actually denounced their loved one because they have issue with alcoholism, with drugs. They need you when they have that issue with alcoholism, with drugs, whatever the case. This is the time they need you. They need you to stand in the place for them, because sometimes people are so much into the drugs, into the alcoholism, until they cannot even tell the top from bottom. So as family members, you have to swallow your pride. You have to help them. So support is key. If you are a spouse, support your spouse. I know it is nerve-wracking, it is painful, but guess what? Once they come out, they will respect you for standing for them. So for those ones who have family members who have issues, you have to stand with them. The biggest problem we have enablers. Family members who are enablers into people who have issue with drugs, you are not helping them. You have to help them. You have to give them tough love. You can tell them, I'm going to help you, but you have to know that this is a problem. Okay? You have to give them tough love. So enabling them, sometimes these people who have that issue, they like to have pity parties. They always are at the edge. You take something, they want to eat you. So you have to also get help yourself. If you are a spouse, a son, a daughter of somebody who has alcohol issues, drug issues, you also need help sometimes, because sometimes you can't do it by yourself. So my whole point is that there is hope, there is help out there. All you need to do is just look for it. Look for it. There are other things that we do nowadays. For those ones who cannot help, there are medications that we give for people who are addicted to pain medication, to street medications. We have like Vivitrol. Vivitrol is an injection we give for 1 month. So you have to come back every month. You get it until you get it. We have some film like Suboxone. Those are some of the medication we give. Suboxone is a film that they take. Like you come once a month and get it. And I ask some of the patients, and they tell me it helps. Say it really helps. We have methadone. People are moving far from methadone, but we have methadone that helps. My whole point is that instead of doing the street drugs, these drugs, of course, these other ones are also drugs, but they are drugs that can make you stable function. Instead of being drunk, you can take your Suboxone, your what is this other one? Vivitrol, I said, Suboxone, methadone. There's one I can't always pronounce it. SUB, whatever. Subutex. So those are the kind of medication they would give you that will keep you sober and have a normal life function. Okay? Have a normal life function. You take one pill a day, then you can be able to go to work. You will not have that withdrawal symptoms. You will just function. But that is not a lifetime solution. That is a small solution until you get yourself together. Okay? So, as I wind up tonight, what I'm saying is that there is always hope for any person who has issues with alcoholism, with pain medication, with strong drugs. There is always hope. You have to be willing to step up and get that help. There is always help. And for the families who are going through this, there is help for you too. Talk to a counselor, to talk to somebody, because sometimes you need, just like abuse and everything else, you need counseling, you need help so that you can function. Because sometimes we think we can help ourselves, but sometimes things are too much for us. So counseling helps also. I know that as Africans, we feel like, oh, counseling, oh my goodness. It helps. It has worked for other people. Why not us? Your insurance pays for it. Why not? Otherwise, have a beautiful, beautiful Wednesday evening and enjoy for the ones back home. Have a beautiful, beautiful day as you're waking up. Have a beautiful day. Share with your friends if you know somebody. I did part 1. This is part 2. Share with your friends who have issues with alcoholism. Share your friends who have issues with drugs. People who need help. The drug I was talking about is called Subutex. Subutex. S-U-B-U-T-X. The other thing before I finish is when you have issues with alcoholism, with drugs, please do not hang around with people who have the same issue. Some, they will want to bring you down by trying to offer you something, and then they will turn around and say, hey, you thought you think the person finished? Is done with alcoholism? I gave him a drink and he drank yesterday. So really, try to distance yourself from anybody who has the same problem, who has the same issues. Just stay away. Stay away, okay? Stay away. Create new friends. Also, for the people who have like children, who have something to look up to. For example, let's say you have a young child, you have your mother, you have somebody. When you are going through the system to get help, think about that person, how they're going to feel when they see you sober. If you have children, think about your children, having a sober mom in the house, cooking, going around for the activities. I mean, you know that your kids will be happy to have a sober mom in the house. Okay, just have something that you will look forward to while you are going through this journey. Because if you have something you're looking forward to, then it gives you morale. It gives you, you know, like that boost to take you to the next level. Otherwise, sometimes it is hard. As for smokers, smoking is an addiction too. As for smokers, if you smoke, you have high blood pressure, you have diabetes, you have stress, honey, those are risk factors. The more risk factors you have, because when you smoke, it constricts your vessels. And when they constrict your vessels, you're prone to stroke, you're prone to aneurysm, you're prone to so many things. So, you too can stop smoking by using nicotine. We give nicotine. We have nicotine gums, nicotine, whatever. they will help you through to stop smoking. But what I tell most patients is that if you used to smoke a pack, nowadays I even know a pack has 20 cigarettes. So if you used to smoke 20, try to wean yourself. Come to up to 10 a day. Come to 5 a day. Come to 15 or 12 a day before you start the regimen of starting to stop smoking. And you know very well that sometimes you cannot take those nicotine patches and smoke at the same time. You can end up having cardiac issues. So there are so many ways you can stop it. Chantix, there's the latest, they call it Chantix. Chantix, for those smokers, they tell me that it gives you, when you want to smoke, it gives you, like that aftertaste. The smoke feels so weird. So that is the latest. The Chantix is the latest we give to patients who want to stop smoking. Complications of smoking is that if you smoke, anytime you smoke over 30, 40 years, you are prone to have COPD. And COPD, you see those people who smoke and they have oxygen, that is what causes COPD. Those are lung diseases. So you might end up having oxygen. There's so many things. If you can avoid now, it's better. It's not easy. Any addiction is not easy. It takes a lot of determination, a lot of hard work, like all other addictions, or like all other things you do in life. Addiction is the same. It is hard. It is hard, but you're going to work hard on it. You're going to fail. You're going to wake up. You're going to start again. You're going to fail. You're going to wake up. You're going to start again until you get it right. That is the biggest thing with anything in life, be it drinking alcohol, be it smoking. You have to know that you're going to fight for your life to stop it. And it is doable. Surround yourself with people who don't drink. If you have friends who drink, you have to banish them from your life, because you will never stop drinking. You will never stop doing drugs if you have those friends you used to do drugs with, because they will enable you. There's no way you will tell me you're going to stop smoking when you have friends who will be smoking in front of you. That smell of smoke, you're used to it. And it will give you the craving to want to smoke again. So you have to surround yourself with people who don't smoke. You have to be willing, like all other things, toxic friends, whatever. You have to be willing to give away some of your friends who drink, who smoke, who are abusive. You have to, like anything in life, you have to be willing. It is hard. It's not going to be easy. But guess what? You have to go down on your knees. You have to go down on your knees. And I've seen prayer works. But prayer without action, without goals on how you're going to finish this problem, you will not succeed. So it has to, prayer has to be followed with action, has to be followed with goals and consistency and a reputation, so that you can end up achieving your goal of stopping smoking, of stopping alcohol, of stopping any form of addiction. Thank you guys. I think that's all I have for you guys. Thank you so much. Be blessed. Have a beautiful night. God bless you, Dr. Pamela Obare, all the way from Michigan, USA. I love you. Love you guys. Thank you for sharing, for allowing me to come to your homes. I don't take this for granted. I appreciate you. Share with your friends. And let's do it. Let me know some of the topics